raised the risk level for the virus from moderate to high for member states as the number of cases continues to grow. British and EU trade negotiators have begun talks aimed at forging a new post-Brexit relationship. Last week, the UK upped the ante after it said it would walk away from the post-Brexit talks in June if sufficient progress isn't made by then. And a teenager who stabbed his mother's ex-boyfriend to death has been sentenced to 2 years in jail. Lawyers for 19-year-old Alexander Whelan, who had pleaded guilty to manslaughter, had said he'd been trying to protect his mother.
The Irish Congress of Trade Unions has appealed to employers to help preserve workers' incomes if they fall ill or have to self-isolate due to COVID-19. Employer group IBEC is advising firms to avail of alternative work practices such as remote working and flexible shifts to avoid loss of pay for affected staff.
Owen Fitzpatrick's company, Fitzpatrick Wholesale in Dublin, employs 18 staff. COVID-19 has already disrupted his supply chain, with important orders from China not yet shipped. His hygiene products are flying off the shelves. He's afraid staff will be hit by the virus. Sick pay covering extensive absence would be unaffordable.
That is an open-ended or possibly never-ending nightmare, where people are just self-isolating on a precautionary basis. The cost implications of that could be huge.
Under Irish law, employers aren't obliged to pay sick pay unless it's provided for in the employment contract. Statutory sick pay from the state only kicks in after 6 days, though some income support is possible subject to a means test. Solicitor Richard Grogan says that many workers face losing out financially, not just if they fall ill, but if they self-isolate while well.
A number of employees are going to be in an extremely difficult position where they're told you should self-isolate, they're not ill, and they're saying, but how am I going to get paid? And really this is an issue that the government has to look at.
The Irish Congress of Trade Unions has appealed to employers to focus on preserving workers' incomes.
Obviously, kind of the issue of workers' pay is an important issue, and Congress is calling on employers to engage with workers and their representatives kind of early so that they understand the implications of what might arise.
Meanwhile, employer group IBEC advises firms to try remote working, flexible shifts and other measures to avoid loss of pay. The big question is, if workers aren't going to be paid for up to 14 days of self-isolation, how many of them will take a chance, come to work possibly ill and expose others to the risk of infection?
Yes, people would take risks in coming to work where probably they shouldn't if they haven't been paid, but then conversely, if people know they can self-certify for a fortnight's extra holiday, you can have a nightmare scenario also.
Ingrid Miley, RTE News, Dublin.
Well, let's get the latest now on this whole situation from the Minister for Health, Simon Harris, who's with us here in studio. Thanks for coming in to us this evening, Simon Harris. First of all, is there still just one confirmed case of coronavirus here?
Yes, there's been one confirmed case so far. As you know, test results are carried out throughout the day, and if that situation changes, there's a daily press briefing now by the Chief Medical Officer and officials in my department. But as of now, there's one confirmed test of COVID-19. We won't be surprised if we see more cases, and we've been preparing for that for a number of weeks.
How many suspected cases have been tested so far?
So those figures are published every week on a Tuesday. As of last week, there were 90 cases, and you might recall I said on that occasion that because we'd expanded the list of affected areas to include places like Italy, I expect that figure when it's published tomorrow to be much larger, but we've only tested one positive case so far. Are
you getting the figures on a more regular basis though? Because I mean, in the way coronavirus is spreading, a week seems like quite a long time.
So obviously once it's a positive case, as we saw, that will be announced almost immediately, and we saw that happen in real time in recent days. But in terms of the suspect cases that have tested negative, we provide a weekly figure.
OK, now the Chief Medical Officer, Tony Holohan, has said there's a low risk of the virus spreading in Ireland. Yet we saw Ursula von der Leyen, the EU Commission President, saying today that the risk to European Union member states is now high. Which is it here in Ireland, low or high?
So what we have here is a very fast evolving and dynamic global situation. We now have 61 countries in the world that have seen a case of COVID-19. And today the European Centre for Disease Control and Prevention, which we get our information from, came out and upgraded that risk. So what happens is our National Public Health Emergency Team, led by the Chief Medical Officer, will meet tomorrow, and it will assess all of the information and advice based on the latest European data. I think it is important for people to note that so far we have not had any community transmission in this country. So So we've had one imported case where somebody came back from abroad, and we haven't seen community transmission. So we're still in the containment phase.
So would you agree with the Chief Medical Officer that it is low risk here?
Absolutely, that's the view as of now. But of course, and Tony Holohan has said this on many occasions, as the situation evolves, and it's evolving on an hourly basis on many days, we'll continue to keep that under review. And our National Public Health Emergency Team will meet tomorrow. I'll also brief the Cabinet tomorrow, and we'll update advices as appropriate then.
Now, a lot seems to be happening tomorrow,
Yes.
but are you getting the information in the meantime, or are you also waiting until tomorrow?
No, I'm being briefed on a very regular basis, often many times a day. I'll also have tomorrow...
So should you be sharing that information with the general population more regularly then?
In fairness to my own department and the Chief Medical Officer, I think we're sharing information on a very regular basis. It's hard to turn on an RTE News programme without seeing a public health expert on behalf of the department updating the people. But we also have to make sure we act in the interest of public health, providing information that's important to keep us all safe and well, but also protecting patient confidentiality. I'll be partaking in a ministerial teleconference tomorrow with the World Health Organization, and I'll also be travelling to Brussels to meet with European health ministers on Friday. So there's an awful lot going on because this is really a global situation of which Ireland is a part.
And in terms of the Irish situation, as you say, a cabinet meeting tomorrow, we saw a little earlier in the programme concerns from the health industry that there aren't enough staff involved in contact tracing and available for treatment should the number of cases increase, as you said yourself, you suspect it will. Can you ring fence any funding? Can you do anything to help the health professionals?
Yes, so Paul Reid, the head of the HSE, is in very regular contact with me. Any resources that they require will be made available. But it is important to say...
And do you have space in your budget for that? Where will that money come from?
Any extra allocation that is required will be made available from government. The Taoiseach's very clear on that, so too is the Minister for Finance. It is important to say, though, if you got to a stage where there were many, many cases in our country, and that's not the stage now, you'd move from what's called the containment stage to the mitigation stage. So at the moment, what we're doing is, anytime a case is identified, is doing the contact tracing, trying to identify anyone a person came into contact with. If you got to a case where there were many, many cases in our country, you'd move to a mitigation stage where you wouldn't necessarily contact trace for every scenario.
And the money will be provided?
Absolutely. I mean, there's huge... And I must also point out, because we're in an interregnum period where there's obviously government formation talks going on, we're keeping the opposition very well briefed, and I want to thank and acknowledge the cross-party support that everyone's providing. This is a real public health issue that we all need to work together on.
Now, if we just look ahead a little to the issue of mass gatherings, St Patrick's Day,
Yes.
and the festivities obviously just around the corner, any decision yet on what the advice might be there?
So what we want to do tomorrow at the Public Health Emergency Team meeting is try and publish guidance for anybody who's holding an event. And there'll be many large events held in our country, or plans to be held in our country, in the coming days, weeks and months. And we want to work with event organisers and to provide them with the best public health information should my event be proceeding. We want to then give them an opportunity to interact with the department where appropriate. In relation to St Patrick's Day, as the Chief Medical Officer said this morning on Morning Ireland, I think we won't be making a decision on that tomorrow. If we had been talking about Italy a while back, or a rugby match, we wouldn't have been considering the possibility that it had to be cancelled. So this is fast evolving. So we'll be keeping all of these issues under review. But tomorrow is about trying to publish advice and to support event organisers in making the right decisions.
Now, we saw just a few moments ago in Ingrid Miley's report the concerns there from workers and from employers about what happens regarding sick pay and so on. Now, if someone is sick with COVID-19, obviously they're sick, they're treated in the normal fashion. But what if someone is told to self-isolate? What provisions are there for them financially?
So as of now, it's important to say there's obviously only one institution of school that has been closed, and staff have been told to self-isolate, and those staff will be paid as normal by the Department of Education. I think the question Ingrid's package raises is fair. What if there's more businesses that are told to self-isolate? We're not there yet. It's really important to say that.
But I suppose people are thinking ahead to that
absolutely.
position.
And if we arrived at that point, we'll be publishing very shortly. We're just finalising guidelines for business. I think some of IBEC's suggestions and ICTU's suggestions are very common sense. Can we help people work from home in some industries? And also there may be a role for the Department of Social Protection in terms of income support. So we'll be bringing forward proposals and guidelines on that in the coming days.
I mean, it could have a potentially devastating effect on individuals and on the economy. Though.
Yeah, I think what we're seeing with this health situation, not just here in Ireland, but indeed globally, is whilst it's clearly a public health situation, there's obviously going to be an economic impact. And the Minister for Finance here, and indeed Ministers for Finance across the world, will be monitoring this as it evolves. If there is disruption to travel and events, that obviously has a knock-on impact. But the message is clear to people tonight. There's no room for complacency, but nor is there any need to panic. We have our best public health experts in Ireland and globally working on this. We'll be providing all of the public health advice needed. So please follow that. Get your information from those reputable sources. And that's the best way of keeping people safe and well here in our own country.
And as you say, lots more information to come tomorrow, but we'll leave it there for now. Minister for Health, Simon Harris, thanks for joining us.
Thank you very much.
Now, anyone who does have a query on their entitlements regarding COVID-19 illnesses is asked to log on to the website for the Department of Employment Affairs and Social Protection, and all the rights and entitlements are outlined there.
Dozens of roadways remain closed in the Midlands and the West as the flooding continues to cut off communities. In County Offaly, the Mid Shannon Flood Relief Group has called on the government to tackle some of the worst black spots along the road.